Hello, this is Allison Newhard. I am with Indiana State University and I will be covering asthma. This is for Nursing 444 in spring 2021. Please take a moment to pause the video and take the pretest. This document is also in link form under the YouTube video in the comment section. Once you're finished, go ahead and press play and we'll continue. The learning objectives, by the end of this presentation, I hope that you will be able to explain the pathophysiological process of the obstructive disease, be able to list the common signs and symptoms, also triggers, be able to identify different risk factors to summarize the different types of treatments available, complications of asthma, also be able to recognize the difference between asthma attack and status asthmaticus. There are also supportive organizations that you'll be able to share with friends and family. Let's start off with what is asthma. According to Lewis et al., the asthma disease affects 18.8 million adults total. 62% are female. About 3,300 individuals die from asthma every year, which is an improvement. It used to be worse, but over the years, asthma has been a little bit more controlled. It is an airway inflammatory disease, and it's very unpredictable. There's no current cure, however, the treatment is based on management of symptoms. You basically want to avoid asthma attacks, avoid triggers, and symptoms range from adequate to poorly controlled, depending on the individual and what's going on with them. Asthma is expressed by the number of symptoms and triggers that induce periods of difficulty breathing. It's an obstructive airway disease, which means it's difficult to get air in and out. It can be based on genetics and or environmental causes that are involved in development. There aren't any clear reasons as to what causes asthma, though. Over time, asthma remodels the lung tissues because of the inflammatory process, permanently changing them. What are some of the signs and symptoms? Shortness of breath, hyperventilation, symptoms that are worse at night or morning, wheezing, can have an asthma with aspirin or polyps. If you have polyps and you have an allergy to aspirin, most likely you'll have asthma. Let's see, can be exercise induced. Cold or dry air can do it. A lot of other triggers are allergen inhalation, like pet fur, dust mite, mold, pollen, air pollutants like cigarette smoke, exhaust fumes, sulfur dioxide, and perfumes. Can be drugs such as beta blockers that cause bronchospasm, occupational exposure such as agriculture, farming, someone who works with chemicals and plastics or detergents, metals, salts, paint, solvents. Can be food additives like beer, wine, dried fruit, shrimp, processed potatoes, monosodium glutamate, sulfites, and tartrazine. Can be from hormones, the menstrual cycle, or acid reflux or stress. What are some of the risk factors? Children, male children are at risk. However, as the individual ages, adult women end up being more at risk. Obesity, genetic predisposition, someone in your family has it. Decreased infections as an infant. Urban, heavy industrialized setting, like in the inner cities. Antibiotic overuse. lack of peer interaction as a child. So if as a child you didn't go to daycare or you weren't around a lot of kids, then you have an increased risk of developing asthma. No pets in the home, indoor outdoor allergens, cigarette smoking, um, history of allergic rhinitis or acute sinusitis, or if you've had a recent viral respiratory tract infection. And acid reflux is also a risk factor. The treatment is basically preventative of acute attacks. You can try desensitization like they do for allergies to decrease the response to whatever trigger that may be affecting your asthma. You can try pursed lip breathing, where you breathe in and um, through your nose, or you can slowly through your mouth by like whistling, as if you're whistling. There's long-term control that are taking medications that are taken every day to avoid an asthma attack, and it's better control. There's anti-inflammatory drugs like corticosteroids, or there's bronchodilators, inhalers, and tablets. It comes in all a variety of forms. Then there's the rescue medications that are the fast-acting medications, such as bronchodilators and anti-inflammatory drugs. Inhaler use and precautions. The one issue is that inhalers are not being used properly, so the patients aren't receiving the full benefit of the medication. You must use short-acting inhalers for exacerbations. If you're finding that you're using more than 2 per month, you need to follow up with your medical provider because your asthma is not well controlled. You need to make sure you rinse out your mouth after dosing to avoid oral yeast infections. You also need to make sure you're cleaning the caps of the inhalers twice a week. Make sure you do not shake the canister and you keep it in a dry, cool area. When you're taking the medication, you need to hold your breath for 10 seconds with each dose. Make sure there's time in between doses. Make sure you open your mouth wide enough for the medication to pass into the lungs. It's really important that the teeth or anything else is not obstructing the passage of the medication. Breathe out completely prior to administering the medication and inhale completely and hold for 10 seconds. If you're taking theophylline, make sure you avoid caffeine and avoid overdose due to liver toxicity. Those symptoms are nausea, vomiting, seizures, and insomnia. Adverse events related to asthma, status of asthmaticus, silent chest. It's extremely life-threatening. That means that there's a severe obstruction. So if someone's having an asthma attack and wheezing, and all of a sudden the wheezing stops and the patient is still having a difficult time, that means that they will be approaching respiratory failure, and this is an emergency. They should go to the ER or call 911 right away. Exacerbations can be mild, moderate, severe, life-threatening. They can progress quickly from one to the other. The exacerbations may arise abruptly, but typically they are gradual. May last up to a few minutes, or might be up to several hours that the exacerbation lasts. Individuals may experience constant debilitation or may be asymptomatic in between exacerbations. Status asthmaticus, or acute severe asthma, is an asthma attack that worsens and is not responsive to medication. So if you take your rescue inhaler or the nebulizer treatments or anything that your doctor has prescribed, it's not getting better, then this can be a sign of status asthmaticus or acute severe asthma. It's a medical emergency and it could lead to death without emergency intervention. So please call 911 or get to the nearest ER as fast as possible. This results in hypoxemia, which is low blood oxygen, hypercarbia, high carbon, dioxide, secondary respiratory failure, and it can be caused by a respiratory infection. So you need to watch out for that if you've recently been sick. Here are some resources for you to use or share with anybody who has loved ones with asthma. And you can take the post test. Go and pause the video and take it. Their link is also included underneath the video. Thank you.